Hi everyone, thank you for joining me for the Features of Assessment for Math Instruction put on by the Rhode Island Intensive Math Intervention Project. We're going to be looking at different elements of assessment in a multi-tiered system of support. Our goals for this session is to understand the differences among various assessments used in the MTSS system, to identify the assessment your school uses and their purpose, with specific attention to how you can use them in your classroom, the Tier 1, and to determine if the assessments used at your school are the best fit for the purpose. At the end of this module, there'll be a coaching activity that can be found in the implementation resource folder that you can use as an assessment inventory to determine if the assessments being used are the best fit. It's called the who, what, when, where, why, and how of assessments, which is the assessment inventory. And it's a great follow-up activity that can be guided by a facilitation lead. Multi-tiered System of Support, or MTSS, integrates assessment and intervention within a school-wide multi-level prevention system to maximize student achievement and reduce behavior concerns. The multi-level prevention system builds upon a strong core, yet in mathematics, there has been no significant change in average mathematics scores for 4th or 8th graders compared to 2015 NAEP scores, and there's been a decrease in scores for lower performing 4th and 8th grade students compared to the NAEP scores in 2015, meaning many students struggle in mathematics, not just those identified as needing tiered instruction. So we, as general educators, need to understand how to support all of our learning and our learners in the Tier 1 setting, identify their needs, and monitor their progress to build a stronger core instruction. You may be familiar with the graphic on the left from various RTI and/or MTSS frameworks. Within a multi-level prevention system, there are typically at least 3 tiers of instruction and intervention. As students are moved from one tier to the next in a flexible way, it is important to remember the more intense the need, the more intense the service and support needs to be. At all levels, instructional decisions must be made based on solid data, which requires appropriate use of assessments. Today, we will focus on a general overview of assessments with particular attention to the use of various assessments in Tier 1. But we will also want to be thinking about the use of these assessments for our struggling learners in Tier 2 and 3 as well. Tier 1 is provided for all students with a goal of effective implementation and responsiveness for approximately 80% of our students, compared to Tier 2, which is provided for approximately 20% of students that struggle beyond grade level core instruction. And then we move to our Tier 3, which is our most intense, and it's provided for about 3 to 5% of our students that are not responsive to standard approaches and need individualization of content. This slide shows common types of assessments: formative, diagnostic, and summative, and the various times within instruction we use these types of assessments. In the next slides, we'll be going more in depth into each of these common types, specifically starting with formative assessment. What is formative assessment? It's an assessment for learning. They're brief measures of direct student performance, typically administered to all students during benchmarking and some students for progress monitoring. There are formal and informal versions of formative assessment. Formative assessments are iterative, meaning they're administered throughout instruction to help guide instructional decisions. Why do we use formative assessment? It's an identification of students who are non-responsive to instruction or intervention. It helps us determine response to current instruction, whether we're talking about Tier 1 core instruction or we're talking about more intensive supports in terms of Tier 2 or individualized supports for Tier 3 interventions. It can be used to identify students who are not responsive and to understand rates of improvement, often not used for grading purposes, but more of a guide to the effectiveness of instruction and whether changes or adjustments are needed. They're also supportive of curriculum and instructional decisions, program evaluation, resource allocation in a proactive model, comparison of instruction and intervention quality and efficacy. Now, let's dig into diagnostic assessment. A student is consistently struggling and not responding to instruction as prescribed by the program or practice specificity. The next questions always become, what are they struggling with? Where are their gaps in understanding? And why are they not responding? This is when we can lean on diagnostic information. What is diagnostic assessment? Diagnostic assessments are often described by how we dig deeper into either formative or summative assessments to determine how to adjust our instruction. Why do we have diagnostic assessments? Because we want to measure a student's current knowledge and skills for the purpose of identifying a suitable program of learning. It can be used to identify areas of strengths and weaknesses for individual students, which can help teachers determine what to teach and help in the selection of appropriate interventions. When do we diagnostically assess? Diagnostic assessments do not need to be complete for all students, but you do want to purposely think about the reason for collecting diagnostic data, for which students and when. Diagnostic tools can be either informal, which are easy to use tools that can be administered with little training, or standardized, which must be delivered in a standard way by trained staff. Do the amount of time to complete the formal standardized diagnostic assessments are used on an individualized basis. Formal standardized diagnostic assessments are generally administered to students when screening and progress monitoring data suggest non-response with the goal of identifying specific deficits in student learning so we can plan an appropriate intervention. These are various forms, both behaviorally and academically, that can be used to help hypothesize how to change instruction in hopes of determining responsiveness. Summative assessments are often assessments typically used for accountability, resource allocation, and measure of mastery over time based on a set of standards. The goal is to evaluate student learning, proficiency, or success at the end of an instructional unit, course, or year by comparing it against a standard or benchmark. Evaluating the effectiveness of school improvement goals, curriculum alignment, and possibly even student placement in various programs, for example, accelerated or AP courses. Summative assessments happen too far down the learning path to provide information at the classroom level and to make instructional adjustments and interventions during the learning process. These help you inform how students did holistically over time and plan for future work, such as updates to curriculum, scope, sequence, pacing. Overall, how successful were students in each grade? Is there a specific grade or population that we need more specific information on to support them in the future work? There are two types of summative assessments. Curriculum assessments, which happen throughout the year based on a set of standards. How did the students do in Unit 2 multiplication strategies and fact fluency after 2 months of instruction with various lessons pertaining to multiplication? And then there are outcome assessments, are the other type of summative assessment that measures a student's learning over a course of the year compared to end of year benchmarks or standards. For example, by the end of third grade, students should be able to represent and solve problems involving multiplication and division, understand properties of multiplication and the relationship between multiplication and division, multiply and divide within 100, solve problems involving the four operations, and identify and explain patterns in arithmetic, develop understanding of fractions as numbers, solve problems involving measurement and estimation of intervention, and many other third grade Common Core standards. Summative assessments help us evaluate to see how those students did against those third grade standards. We've talked about the common types of assessments: formative, diagnostic, and summative. Now let's look at key takeaways that you can use in your classroom on a day-to-day basis. So for formative, we have screening, which helps us determine risk, and progress monitoring, which helps us determine when we need to make instructional changes. For diagnostic, it helps us determine how to change our instruction. When using diagnostic assessments to determine how to change the instruction to support groups of students, first start with informal formative assessments. Progress monitor to determine responsiveness, and then use formal diagnostic on individual students that are consistently non-responsive. You may also use more formal diagnostics on individual students that are truly at risk, those true positives for not achieving academic outcomes. Remember, this is often a very small percentage of students. Lastly, are summative assessments. This is for true curricular and outcome assessments. It helps us determine if what we did worked over time.